Conversational English Test, Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at notes for extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient about recent weight loss. For questions 1 to 12, complete the note with a word or short phrase. You now have 30 seconds to look at the notes.
Mrs. Jacobs, how are we doing today?
Okay, I suppose.
So I see here that you made the appointment because of recent weight loss. How much weight have you lost?
Approximately 10 kilograms in the past 4 months or so.
Okay, and I'm going to assume that this weight loss has not been intentional?
Oh no, I just haven't had much of an appetite, and I'm having an increasing issue with vomiting.
I see. And does your vomiting happen soon after eating?
No, it generally happens many hours after I have eaten.
And are you experiencing any other changes in your health?
Yes. I live alone in a 2-floor house, and I have noticed over the last month that my legs feel weak when I go up the stairs or walk up a small hill near my house.
And I remember you telling me that 2 years ago you were prescribed beta blockers or hypertension. Are you still taking that medication?
Well, I stopped taking the beta blockers about 4 months ago.
Okay. Well, let's take a look at the investigations that you had done for this appointment. So I see that urea is out of the normal range and quite a bit higher, which suggests dehydration. That is to be expected because of the vomiting you just mentioned. And look here, your sodium and potassium levels are lower than I would expect. That is also likely due to the vomiting. The low potassium levels also likely explain the weakness you have been feeling. So you said that you vomit quite a bit of time after eating, correct?
Yes, that is correct. Several hours at least.
I'm afraid everything points to obstruction to stomach outflow. I can also hear a sloshing sound through my stethoscope, which suggests the presence of gas and fluid that are trapped inside the stomach.
So things can't go out, so they are coming back up?
That's one way to look at it.
But what could be blocking the food from leaving my stomach? I mean, that sounds quite serious.
Unfortunately, I cannot tell what the cause is from these investigations.
If the problem is in my stomach, wouldn't I be having stomach pain?
Depending on the cause of the obstruction, there would not necessarily be abdominal pain. So we will have to do a gastroscopy and biopsy to confirm the diagnosis and look for the cause of your problem. We could be looking at a chronic gastric ulcer or a tumor in the pyloric antrum, which is a part of your stomach near the bottom. But because of the retained food in your stomach, we will need to wash out your stomach to make sure we can see what is causing the obstruction of the outflow tract of the stomach.
Extract 2. Questions 13 to 24. You hear a doctor in the A&E talking with a patient with persistent headaches. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Saunders. How are you today?
I am well, but please do call me Nathan.
Okay. Nathan. So, I see here that you came into the hospital because of a number of problems, including a deterioration of vision of the past 3 days, reduced urinary output, and ankle swelling.
Yes, and the headaches. They are horrible. Before recently, I have never really had headaches, so it has been difficult for me.
So exactly how long have you been experiencing these symptoms?
Well, the failing vision and all the rest of that. Just the past 2 to 3 days. But headaches have been going on for about 4 months. There is a constant throbbing, and simple analgesics are not working.
Have you seen a doctor for the headaches before today?
Oh yes, I went to my GP about 2 months ago. She said I had tension headaches and gave me codeine for it. But that didn't work either, so I went back to her a couple of weeks after that. So about 3 weeks ago now. She gave me another medication, but I don't remember the name of that.
And was that medication effective?
No, the headaches continued, and then about 3 days ago they became worse, and my vision went all blurry. That's when I also noticed that I wasn't really going to the bathroom that much, and also that my ankles were swelling.
So let's take your blood pressure. Oh my, your blood pressure is 190 over 140.
That's bad, isn't it?
Yes, it is. It is considered hypertensive crisis. Was your blood pressure measured when you went to the GP for the headaches?
Not that I can remember. I mean, if it was, my GP certainly didn't say anything at all about it being high.
I can also see that you have retinal hemorrhages and papilledema. This, along with what may be renal failure, points to accelerated hypertension. The most important thing right now is to lower your blood pressure at a gradual rate over the next 24 hours. Rapid reduction can be dangerous and can cause arterial thrombosis and problems in a number of organs. I'm going to order an IV of antihypertensive drugs. It is also necessary to control your fluid intake and keep you under observation for the onset of pulmonary edema. We may also need to put you on dialysis due to the problem with your kidneys.
Dialysis? I mean, are my kidney problems that serious?
Well, if we notice the development of a pulmonary edema, dialysis will be necessary because you will not respond to diuretics due to the problems with your kidneys. As to the severity of your renal failure, we don't know yet if the renal failure is chronic or acute, or a mixture of both. The kidneys are being damaged by the hypertension, but at this point we don't know if they are chronically damaged or if there is some other undiagnosed renal disease. We will also do a renal ultrasound, which is quick and non-invasive, to be sure about the size of your kidneys.
What will the size of my kidney tell you?
Well, kidney atrophy or shrunken kidney would indicate a damaged kidney.
And what about my vision? Is this vision loss permanent or long-term?
I don't think so. Your impaired visual acuity should recover completely.
And what about my kidney? If there is damage, is it permanent?
Again, we'll have to wait and see about that. Your hypertension has been damaging your kidney function for several weeks now, so...
is the end of part A.